Good afternoon. This is All India Radio and I am Gurmala Kapoor with the Midday News. The headlines. ICMR says there is no evidence of community transmission in India. Testing facility ramped up to detect COVID-19 cases. Focus on social distancing, hand sanitization and restriction of mass gatherings to contain the spread of COVID-19. Supreme Court says if telecom companies self-assess or reassess AGR dues themselves, they will be held for contempt of court. Government committed for revival of BSNL, says Telecom Minister Ravi Shankar Prasad, and Yes Bank to start full-fledged banking operations from 6 p.m. today. Director General, Indian Council of Medical Research, ICMR, Dr. Balram Bhargav, has said that the country has not yet seen community transmission of the novel coronavirus outbreak. Dr. Bhargav said India continues to be in stage 2, which is local transmission.
Majority of our patients who have arrived have a history of travel or direct contact with a history of travel. That is local transmission. We cannot say that community transmission will not happen. That cannot be predicted, and that would depend on how strongly we close our international borders, in terms of which the government has taken very proactive steps. So that should help prevent the community transmission.
Dr. Bhargav said all 500 random samples have tested negative for coronavirus. He informed that ICMR has decided to intensify testing facilities with an expansion of its network of laboratories. Dr. Bhargav said, at present there are a total of 72 functional laboratories in the ICMR system, and that it has also engaged other government laboratories, which include CSIR and DRDO. 49 of these labs will start testing by the end of this week. He said ICMR is setting up 2 rapid testing laboratories at different places which will have the capacity to test 1,400 samples per day, and it will become operational by the end of this week. He said ICMR is also engaging with high-quality private laboratories that include laboratories accredited to the National Accreditation Board for Testing and Calibration Laboratories NBL to understand the modalities to increase access to COVID-19 tests while ensuring appropriate standards. Dr. Bhargav said all asymptomatic patients who have taken international flights in the past 14 days should get tested if they develop symptoms. With confirmation of 2 more new positive COVID-19 cases in Leh, the total number has risen to 8 in the Union Territory of Ladakh. Both cases have been quarantined in a hospital facility in Leh and have been shifted to an isolation ward in the Sonam Norbu Memorial Hospital. As a preventive measure, the District Magistrate Leh has ordered closure of all gyms, recreation clubs and other such places in Leh district. The UT administration has placed 1,495 persons under surveillance, which include 1,332 from Leh district and 163 from Kargil district. Meanwhile, 150 persons have completed their mandatory quarantine of 14 days. The Union Government has deputed 30 additional secretaries and joint secretaries to assist the state governments in effective management of COVID-19. They will be deputed to the states and will work in close coordination with the state authorities for coordinating the preparedness and the response measures. An orientation meeting of all the officers will be held today. The total number of confirmed cases of coronavirus in the country has now reached 147, including the 14 who are now COVID-free and 3 reported deaths. According to WHO, there are now 1,97,139 confirmed cases worldwide, with 7,916 global deaths recorded. The main bulk of deaths come from China, where the virus first emerged last December. But the virus is now spreading faster outside China than inside, with a lot of focus moving to Europe, where cases have spiked over recent weeks. The European Union has now banned travellers from outside the bloc for 30 days, as cases continue to soar in Italy and Spain. The government has approved 2 AirAsia flights for Delhi and Visakhapatnam to help Indians stranded at the Kuala Lumpur airport due to the coronavirus outbreak. External Affairs Minister S. Jaishankar said in a tweet that the flights have been approved as Indian students and other passengers waited in transit at the Kuala Lumpur airport are facing a difficult situation. According to reports, over 200 Indians, mostly students, are stuck at the Kuala Lumpur airport. India has banned the entry of passengers from European Union countries, Turkey and the UK till the 31st of March. It has also closed its doors to those from Afghanistan, the Philippines and Malaysia. Dr. Raman Sharma, senior professor from SMS Hospital, Jaipur, whose team treated Italian patients of COVID-19, shared his experience of treating the patients. Speaking exclusively to All India Radio News, he said, people need not panic and follow basic hygiene. He said that all the individuals diagnosed by COVID-19 do not need treatment. He added that people with extreme symptoms need to be treated.
घबराने की जरूरत नहीं है. आपको बहुत जरूरी है कि सावधानियां बरतें. अगर आपको रेस्पिरेटरी सिम्टम्स हैं, बुखार है, खांसी है और सांस वगैरह फूल रहा है, तो आपको एक तो डॉक्टर से संपर्क करना चाहिए और अपने आप को घर के अंदर आइसोलेट करके रखना चाहिए.
The Rajasthan government and other departments have taken several steps for the management of COVID-19. North Western Railways have also increased rates of platform tickets from 10 rupees and 50 rupees to stop the unwanted crowds at railway stations. More from our correspondent.
Famous historical monuments, forts and tourist places like Hawa Mahal, Jantar Mantar, Amir Fort and other popular spots have been shut down till end of this month. Fairs and festivals to be organized by Tourism Department and other organizations across the state have also been cancelled. Forest Department cancelled all safaris in Ranthambore and Sariska National Park along with Jhalana Leopard Park. Nathdwara Temple Board has cancelled darshan at Srinathji. Jitendra Dwivedi, AIR News, Jaipur.
The Bharatiya Janata Party will not participate in any movement nor protest till next month in view of the COVID-19 outbreak. Party President JP Nadda told media persons in New Delhi today that Prime Minister Narendra Modi has desired that the party should refrain from participating in any kind of movement and protest till next month.
अगले एक महीने तक भारतीय जनता पार्टी किसी भी तरीके का जन आंदोलन नहीं करेगी, न ही किसी प्रदर्शन में भाग लेगी. कोई अगर विषयों के बारे में चर्चा करनी होगी तो 4-5 हमारे वरिष्ठ कार्यकर्ता संबंधित अधिकारी को ज्ञापन देंगे, लेकिन आंदोलन से अपने आप को दूर रखेंगे.
Mr. Nadda said the party has sent similar directions to its state units to be alert and to create awareness. In view of the spread of COVID-19, the Delhi police have issued an appeal asking people to remain indoors as far as possible and not to come outside for leisure or entertainment activities which involve close contact with more than 4 to 5 persons at any place. It has also appealed not to assemble at any place for protest, dharna, rally or any other activity, whether in a closed space or outside till the 31st of this month. The police said it will not issue any no objection certificate nor permission for gatherings. The railways have cancelled 85 trains as a precautionary measure against the coronavirus and low occupancy. The railways have also asked their catering services not to deploy any employee with fever, cough, runny nose or with difficulty in breathing for the handling of food items. The Central and Western Railways have announced a steep rise in the prices of platform tickets to prevent unnecessary crowding at their stations. In the wake of the growing COVID-19 cases in the country, the Health and Family Welfare Ministry has issued an advisory for the people. Here is a report.
The Ministry of Health and Family Welfare has advised people to follow basic protective measures to keep themselves safe from the novel coronavirus. People should avoid participating in large gatherings. If a person is experiencing cough and fever, he or she should avoid close contact with others. People are advised not to touch their eyes, nose and mouth without cleaning their hands. Spitting in public places should be avoided. All persons should practice frequent hand washing with soap and water or use alcohol-based hand rub. Used tissues should be thrown into closed bins immediately after use. In case of fever, difficulty in breathing and cough, a doctor should be consulted immediately. The Health Ministry has issued a toll-free number 1075 for the public for inquiry about coronavirus. It has also issued an email ID ncov2019@gmail.com for any assistance on the pandemic.
However, experts have said that there is no need to panic, but that people should take appropriate precautions in this regard. Talking to All India Radio, Dr. Randeep Guleria of AIIMS said,
ये बात समझना जरूरी है कि हर एक खांसी कोरोना वायरस नहीं है, इसलिए इसके साथ दो चीजें अभी हमारे जुड़ जाती हैं और एक ये है कि पिछले 14 दिन में अगर आप किसी ऐसे देश से आए हैं, विदेश से आए हैं जहां पे कोरोना वायरस एपिडेमिक हो रहा है, या आप किसी ऐसे पेशेंट के संपर्क में आए जो लेबोरेटरी कंफर्म्ड कोरोना वायरस केस है, तभी आपको जो बुखार खांसी है हम समझ सकते हैं कि ये इसका शक हो सकता है कि कोरोना वायरस के कारण है। अगर किसी को वैसे खांसी हो रही है और वो कहीं विदेश नहीं गया है या किसी ऐसे पेशेंट के संपर्क में नहीं आया है, तो ये आम खांसी है, आम जो मौसम के साथ जुकाम नजला होता है वही है, इसमें कोई घबराने की बात नहीं।
The News Services Division of All India Radio, in its bilingual live phone-in program today, will bring you a discussion on Corona Jagrukta series. Listeners can ask questions from the experts sitting in our studio on toll-free telephone number 1800-115767. You can also ask questions on telephone number 011-2331-4444 and post queries on our Twitter handle at AIR News Alerts by #AskAIR. This can be heard tonight on FM Gold channel and additional frequencies from 9:30 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel News on AIR Official. You can also follow us on the News on AIR app for updates. This is All India Radio giving you the news. For quick news updates, visit our News on AIR app and follow us on Twitter at AIR News Alerts. You can also visit our website www.newsonair.com. Union Minister for Telecommunication Ravi Shankar Prasad has assured that the government is committed for revival of Bharat Sanchar Nigam Limited. Replying to a question in the Lok Sabha today, he said the employees who have opted for voluntary retirement are being taken care of and that their dues will be settled as per the scheme devised by the government. He also said that if the dues, if any, for the contractors will be settled so that the contract employees will get their salaries.
मेरी सरकार का ये कमिटमेंट है कि BSNL, MTNL जीवित भी रहे, प्रतिस्पर्धा में भी आए। इसलिए अगर वही पुराना चिंतन रखेंगे जितना एम्प्लॉय का लोड था तो ये उचित नहीं होगा सर। इसलिए उस पदों को हम रिटेन नहीं कर पाएंगे। BSNL, MTNL दोनों अधिक प्रोफेशनल बने, अधिक प्रतिस्पर्धी बने, जिसकी हम पूरी कोशिश कर रहे हैं।
The Minister for Coal, Prahlad Joshi, today said that the centre has written to all states not to import coal as there was sufficient coal available in the country. Replying to a question in the Lok Sabha today, he said there are coal reserves which are to be utilized within a period of 35 years. To another question on rehabilitation of people living near coal mines in Dhanbad, he said legal title holders of land will be compensated. The Rajya Sabha was adjourned till 2 p.m. today following protests by the Congress members on the issue of the reported detention of a senior party leader in Karnataka. The issue was raised during 0 hour by senior Congress leader Anand Sharma and others. They rushed to the well of the House raising slogans against the government. This forced the chairman, M. Venkaiah Naidu, to adjourn the House. Yes Bank CEO designate Prashant Kumar has assured customers that complete operational normalcy will be restored from 6 p.m. today. Stating that there are absolutely no worries on the liquidity front, Mr. Kumar said all the bank branches and ATMs have an adequate supply of cash. The Supreme Court today took note of the non-availability of midday meals for children as schools in many parts of the country have been shut down due to the coronavirus pandemic. A bench headed by Chief Justice S.A. Bobde took suo motu cognizance of the matter and issued notices to the states and union territories asking them how children were being provided midday meals amidst the shutdown of schools. Schools in Delhi, NCR and many other states have been closed till the 31st of March in view of the COVID-19 outbreak. BJP MP Dr. Satyapal Singh today congratulated the Yogi Adityanath government of Uttar Pradesh for completing 3 years in office. Speaking to media persons outside Parliament House, MP from Bagpat in Western UP, Dr. Satyapal said that in the last 3 years there has been a tremendous change in the situation on law and order in the state. Celebrating the second anniversary of Poshan Abhiyan, Poshan Pakhwada is being observed across the country. In Nagaland, all the convergent departments are taking key role in organizing various activities across the districts to mark the fortnight Poshan celebrations.